And Public Health Ontario released a new report showing the Kraken COVID-19 subvariant is beginning to surge in the province, with prevalence rising from 2% of cases in the end of December to 20% of all cases in the province as of today. And for more on this, I'm joined by Dr. Fahad Razak, internal medicine physician at St. Mike's Hospital. Good afternoon, Dr. Razak. So first off, can you run us through this report and give us a sense of how concerning this surge is in the Kraken subvariant, also known as XBB.1.5?
Yeah, good to be back, Makari. This was an expected rise in the sense that we've seen this variant, XBB.1.5, surging in the United States, probably more than 3/4 of all cases in the northeastern part of the United States, which obviously borders Ontario. And so we know that people are going back and forth across this border. As of the end of December, we hadn't seen much of a rise yet. But as you said, this report now shows that the rise has been from about 2% to 20% over the last 3 weeks. If we follow the U.S. trajectory, that means that this will become the dominant version of the virus circulating probably within just a few weeks in Ontario and across the country. In parts of the U.S. where that occurred, they did see a rise in hospitalization, nothing like what they saw earlier in Omicron, where we had these huge surges, but still something meaningful. And, you know, as all of you know, we've had such strain on the healthcare system over the last few months, children's hospitals, adults hospitals. So there is a need, I think, now to recognize that we're probably going to see a surge of infections in the coming weeks and talk about what we can do to reduce infection as much as possible.
Okay, Dr. Razak, what does this surge say about how transmissible this new subvariant is?
Certainly more transmissible. We're seeing that both in the fact that it is outcompeting other versions of the virus. So what you're seeing is that it's displacing the other variants around it. When all of these variants were flooding throughout the system throughout the fall, there wasn't really one clear version of the virus that was ascendant. But we're now seeing that with this version, with XBB.1.5. And so as that version outcompetes the other versions of the virus, it seems to have the tendency to evade some of our immune protections, reinfecting people who've had infections but not that recently, or whose immunizations are out of date.
Okay, and speaking of, we have to talk about the efficacy of vaccines, bivalent vaccines.
Yeah, to the best of our knowledge, these bivalent vaccines that we have available now in Canada should give you added protection, especially against severe disease. It's important to note that most eligible Canadians and people in Ontario who are eligible for the bivalent have not yet received it. And as we see this rapid surge occurring in this variant, this would really be the time to go out and get that vaccine if you haven't already received it. Look, I think at this point in the pandemic, we're really talking about mitigating strategies to allow people to continue on with all the things that are important with them. And getting your vaccines up to date is part of that. It means not missing work, not missing family events, not being sick and knocked on your back for a few days. So I think whatever you can do to reduce that risk is important.
And Dr. Razak, as we wrap up, you know, looking at the rates down in the States and then, you know, the spread here, we have to talk about the lion's share of the cases in the province. And, you know, what are your final words to people about this?
I think we have to treat these viral surges and this latest variant as something that's probably going to happen again and again for us, at least for the coming months to years. It's really about being able to adapt in the moment, take the strategies you need, things like keeping your vaccines up to date, the other protective measures during a surge, like masks and indoor crowded settings, or not mixing with friends, family, and coworkers when you're sick. And so I think we need to use those strategies adaptively so we can do the things that are most valuable to us, not allow these viral surges to really disrupt us. And I'd like to see us all get to that place.
Dr. Fahad Razak, internal medicine physician at St. Mike's Hospital, thank you very much for coming to speak with us.
Nice to be with you.